How you doing? HM2 Marker. We're going to be going through the GU-PCL. First things first, we're going to go through the breast and axillary inspection, palpation exam, and then after that we'll go into the actual speculum, cervical exam, path, the whole 9 yards. So to start with, you start everything like you always do, your V-teams, your vitals, your tobacco, alcohol, medications, and allergies. After that, though, this one's a little different, so you have to kind of go into an HPI, past medical history, family history type thing. So first thing you're going to do is you're going to ask the patient about the date of their first period, so the menarche, or the menarche, whatever you want to pronounce it. So when did you first have your period?
Age 12.
Okay, awesome. And then when was your last menstrual period?
A week ago.
Okay, great. And then you would want to get more specific if the instructor wants you to, but after that, if it was applicable, you would also talk about the date of menopause. Then you're going to go into kind of some things like, when was the date of your last path?
6 months ago.
Awesome. And then you would go into, do you do your basic, your breast self-exams?
I do.
Okay.
In the shower.
Okay, great. And then do you also do your like genital exams, self-exams?
I look down there with the mirrors sometimes.
Awesome, perfect. Now, in the event that it's a guy, you would still ask about the breast self-exam. You know how to, guys can get breast cancer too, yada yada yada. And then also you're going to do ask them about self-testicular exams. So do you do self-testicular?
Yes, I do in the shower.
Good, awesome. And then next would be a past medical history. So you're going to look into things like any abnormal breast exams or any abnormal breast findings that they've had in the past. Fibroadenoma, fibrocystic breasts, or if it's a guy, gynecomastia. Then you're going to roll into if they've ever had a history of cancer. So endometrial cancer, and I just list off as many cancers as I can think of. So endometrial, cervical, uterine, ovarian, breast cancer, and then guys, testicular cancer. I think that's everything, right?
That's perfect.
Cool. And then after that, you're also going to ask about if they had a history of, like, I think it's diabetes, any hypertension, cardiovascular stuff, all that. And then also you're going to ask about UTI, STI, and birth. So they use the acronym GPAL. So that stands for gravidity, parity, abortions, and living children. Okay, so gravidity is just how many times have you been pregnant, whether you've come to term or not. Parity would be how many births you've actually had, you've delivered, and then obviously abortions and living. So after that we go into family history. So now you're talking about the same types of cancers that you just asked about. Testicular if you're a guy, endometrial, uterine, ovarian, breast, all that jazz. Then you're also going to ask about diabetes, cardiovascular disease, hypertension, liver issues, and then infertility. So kind of a funny question to ask if they have a family history. Never mind, forget it. If you think about it, it doesn't make sense. Infertility? All right, okay. Anyways, after that you go into your actual exam. So the first thing you're going to do is you're going to observe the breasts and the areola and nipple. So this can be just when the patient is sitting like this, and you can kind of get a couple different views. Okay, good to go. Next thing you're going to do is you're going to want the patient to, there's 3 different positions when you're doing your observation. So just mimic me. So go ahead and put your hands up over your head. Okay, good. And then same thing, when they have their hands up like that, you're going to want to check from different views. Next would be hands on the hips, and then roll the shoulders forward. Okay, good. And it's going to change kind of the shape of everything, obviously, with the mannequin, with the big ones, it's a little different. Okay, cool. And then the last thing you're going to want to do is you're going to want to have them put their arms out front, like Superman, and lean forward. And this is going to change kind of the angle, you're going to be able to see if it's more pendulous or anything like that. Okay, great. So now we go into the actual palpation of the exam. So still while the patient is sitting, so you're going to do the basic chest wall sweep, okay? So for patient comfort purposes, I'm just going to put my hand here, and you're going to do a sweep down the breast, okay? You're going to come about from the 2nd intercostal space all the way down to about the 7th, because that's pretty much where all of the breast tissue is. So you're going to do your breast sweep down like this. Sorry, my hands are cold.
You want to rotate sides, though.
Yeah. Just for purposes of the video right now, I'm just doing it like this. And then obviously you also want to go underneath the breast, okay? So after that, what you're going to do is your bimanual palpation of the breast. So one hand underneath, and you'll be able to go ahead and just work your way down.
All night long.
Okay. All the way down, and you're going to do the same thing both sides. And then after that, you're also going to assess the lymph node chains. Okay, so it's going to be supraclavicular, infraclavicular, anterior axillary, and then at this point, too, you can have the patient put their arm up to the side. We'll just do one side at a time. Yep, just like that. And then anterior axillary, mid-axillary, which can also be the brachial, and then posterior axillary, which would be like the subscapularis. And then you can have the patient lie down for the next part. And for comfort purposes and also an easier way to assess the breast is you go ahead and have them put their hand behind their head. Good. Now, obviously, yeah, you can go ahead with this side. So now when you do this, you're going to be palpating the breast tissue at this point. Now there's a couple different ways that they talked about doing it. The way that I like to use is the wagon wheel method, okay?
Wedge.
Or the wedge method. So you can either start away from the nipple or start at the nipple and work away. It doesn't really matter. So you kind of work your way down, okay? And you're just assessing for any nodules, any fibroadenoma, fibrocystic areas, anything that just doesn't feel right. So you're just going to work all the way around the breast, and then you do the other side as well. While you're working on one, the next part of this is you're going to do the depression of the nipple. So you're going to push the nipple back into the well, and you're assessing to see if it has any maybe adhesions or any abnormalities. Now the other part of this is the compression of the nipple. So instead of doing it, like this, it's more professional to do it like this. And this is going to be to assessing to see if there's any discharge from the nipple. Okay? And when you're doing your palpation, at least in this step, light, medium, and deep palpation. Okay? So it's not just a single, I'm just going to go deep the whole time. Start off light. The patient becomes a little bit more comfortable, then you can do your medium and your deep. Okay, and you can probably verbalize that aspect of it. But make sure you're also doing all the way up into the tail spens, 4 quadrants of the breast. So you have your upper inner, upper outer, is it lower inner, lower outer. Okay, and then take a look at the Mosby's for any abnormalities and just review kind of the things that you might be able to find as far as abnormalities on a breast exam.